There are many things you can do to help prepare you for your spinal surgery. The single most important thing you can do to decrease your risk of infection is to wash your hands. All of your family members and visitors should also be encouraged to wash their hands frequently.
About 2 to 3 weeks before your surgery, or some of you may be at this point already, we would like you to start washing all over with an antibacterial soap. You can use something like Dial. There are also inexpensive generic versions at Walmart, Walgreens, and even Fred Meyer. You should have already gotten this packet of cleaner from your neurosurgeon's office called HibaCleanse. The night before your surgery, we want you to take a bath or shower like you normally do, washing your whole body and hair with your normal cleanser. Then open one of the packets and put it on a clean washcloth and wash from the neck down, except the face and genitals, with this cleaner. Spend about 2 to 3 minutes in the areas where you'll have surgery. Make sure you rinse the HibaCleanse off well. It has an orange color that can stain your skin and clothes. This special cleanser can also be very drying to the skin, but we ask that you not use any lotions or creams after using the HibaCleanse.
I think the best thing to prepare for surgery is ask lots of questions. The Spine Center offers a class that can also give you a lot of good information on how to prepare for surgery.
So I went into the class of the spine clinic, and Jenny gave a very, very thorough 2-hour class on all the do's and don'ts of what we should to make this as pleasant as possible. And there was a lot of participation. There was a lot of questions and answers in the class. People seemed to enjoy it real well, and I did. I enjoyed it immensely as far as those type of classes go. It's very informative.
This class is held twice a week and reviews different exercises for your back, what to expect before, during, and after surgery in the recovery period. In general, I recommend starting activities that are going to be healthy for your spine in the long run. If you smoke, I recommend quitting smoking. That will improve the healing process. And staying active, including walking.
Some of you may be required to be smoke-free by your insurance company or your surgeon before your surgery. Your neurosurgeon will discuss this with you. Salem Hospital is a smoke-free facility. You will not be able to smoke from the time that you are admitted for your surgery until you are discharged. We also will ask your family and friends to leave the hospital grounds to smoke. If you need help quitting smoking, you can contact the American Lung Association. The Community Health Education Center, or CHEC, here at Salem Hospital, is also a great resource about quitting, including classes and support groups. Your primary care provider also has resources available to help you quit.
The spine degeneration is much faster in people who are overweight and in people who smoke. Smoking constricts the blood vessels that give supply to the spinal bones, and in doing such, lead to advanced degeneration. So keeping your spine healthy over time involves maintaining a healthy weight and not smoking.
A healthy diet and proper nutrition are important aspects of wound healing after surgery. You should eat a healthy diet, high in fiber with protein, whole grains, and fruits and vegetables. We also want you to start taking a fiber supplement about 1 week before your surgery. This can be something like Benefiber or Metamucil or fiber tabs. Make sure that you take them with a lot of water. 2 weeks before your surgery, we want you to stop taking any supplements, fish oil, and herbal medications. Make sure you discuss this with your surgeon. This is also a great time to start getting your home ready for when you return home after your surgery. Look around your living spaces and look for any potential things that may trip you after your surgery. Do you have a rug that is curling up or cords pulled across the living room floor? Do you have a rug in the kitchen that slides when you step on it? Now is a good time to make sure that all of the pathways are clear and open. You will be spending a lot of time sitting for a couple of weeks after your surgery, so we want you to find a chair that is comfortable for you and offers good back support. Make sure it does not have wheels. Some people find a recliner the most comfortable, while others prefer a more straight back chair. Either is fine. It just depends on your comfort. Make sure that whatever chair you choose allows you to maintain those spinal precautions of no bending or twisting. It will be a couple of weeks after surgery until you are comfortable enough to cook a meal. You should make arrangements for meals for at least 2 weeks after your surgery. If you have family, friends, or church groups asking what they can do to help, have them bring some meals, or freezer meals is a great way to help. Please use night lights for the first couple of weeks after surgery. We know that you are familiar with your house, but you may need a little additional light for a couple of weeks until you get comfortable. Pets can increase your risk of falling. We know that your pet will probably miss you while you are away, and that they are going to be excited to see you when you get home. For your safety, we ask that you have the pet safe in another room. Let you come in and get settled, and then have your pet come in and greet you, so that they're not running around your feet, increasing your chance of falling. For the first 48 hours after surgery, you need to have someone available in case you need help. You do not need to have someone with you all the time, but someone does need to check with you occasionally in order to make sure that you're okay and be available by phone. Not all of you will spend the night in the hospital. However, we do encourage you to pack an overnight bag even if you aren't planning on spending the night. You can leave it in the car and have it brought to you if you need it. Occasionally, our outpatient surgeries have to spend the night, though most leave for home on the same day. If you wear a CPAP or BiPAP at night, bring the mask and your settings. You do not need your tubes or machines. We have those you can use here at the hospital. The settings are the number that the dial on the top is pointing to. Bring a pair of slip-on shoes or slippers. These should not be too snug before surgery because your feet may swell a little after surgery. Make sure that these have backs and non-skid soles. Bring any personal items that you may need, such as a toothbrush and toothpaste. Bring your patient guide with you. If you are planning on using a walker after surgery, please bring that with you. It is not required for your surgery, but if you have one or are planning on borrowing one, bring it with you to the hospital the day of your surgery. You don't need to bring it with you when you first check in, but have someone bring it up from the car when you get to your room. Nursing and therapy staff will work with you and your walker to make sure that it fits you properly and that you know how to use it correctly. Bring your insurance card and photo ID. If you have a brace, don't forget that. If your surgeon did not tell you you need a brace, don't worry. Not all of our surgeries require a brace. If you had your brace fitted at Hanger, they will deliver your brace to your room at the hospital. Bring a list of your medications. Make sure the list includes the dose and when you take them. But please leave all medications except eye drops, inhaler, and birth control at home. Leave your jewelry and valuables at home. A week before your surgery, please stop taking any anti-inflammatory or NSAID medication. This includes Advil, Aleve, and ibuprofen. These medications can increase your risk of bleeding during surgery and decrease your wound healing after surgery.
NSAIDs is an acronym standing for non-steroidal anti-inflammatory drug. And this is a class of medications that include aspirin, ibuprofen, naproxen, and other prescription medications like flurbiprofen and Atoladoc.
You can continue taking Tylenol, but make sure that you follow the label instructions. If you are taking certain pain medications such as Percocet, Vicodin, or Norco, these medications contain Tylenol, so please do not take any Tylenol in addition to these medications. If you take blood-thinning medications such as aspirin, Coumadin, warfarin, Pradaxa, Plavix, or Effient, discuss with your surgeon when to stop taking these medications. You may require additional monitoring if you take one of these medications.
The reason why you want to stop taking those medications is because what they do is they not only relieve certain types of pain, but they also prolong bleeding time. And when you have surgery, you want to be able to control how much a patient bleeds.
Stop taking any herbal medications and discuss with your surgeon any over-the-counter medications that you take. You can continue to take all other prescribed medications, including pain medication, as directed by your neurosurgeon. Now is also a great time to prepare healthy snacks to eat throughout the day after your surgery. Having high-protein, high-fiber snacks on hand for after surgery can assist you in your recovery. The night before your surgery, bathe using the special cleanser. Put on clean clothes and sleep in clean sheets. Please avoid any colognes, perfumes, and lotions. Avoid eye makeup and make sure you don't wear your contact lenses the day of surgery. Both of these things can increase your risk for corneal abrasions during surgery. Someone from the pre-surgery department at the hospital will call you the night before your surgery to tell you what time to arrive for your surgery. If you are having surgery on Monday, they will call you on Friday. Your surgeon's office may have told you what time to be here. Please be aware that time is subject to change. It usually does not change more than 15 to 30 minutes, but could change up to several hours. Absolutely no food or drink after midnight. Even if your surgery is not until the afternoon, no food or drink after midnight. The morning of your surgery, we want you to shower with the other packet of cleanser and put clean clothes on again. You may be instructed to take some of your medications. Take only the medications you were directed to take with a small sip of water. You can take your normal pain medication with a small sip of water the morning of your surgery. Park under Building A and go to the information desk in the lobby of Building A. There you will be directed to the correct floor for your procedure.